Welcome to Burlap Teachers. Enjoy the video.
You begin by confirming the clip fits your dental anatomy. Small adjustments now save irritation later. Once done, clean both clip and teeth thoroughly and dry them to ensure adhesion and comfort. Make sure to test fit on a rear tooth first so you understand orientation and pressure points. You'll feel where it grips. If it rocks, reposition or choose a different size. This early trial prevents forcing a bad fit and reduces the chance of damage to enamel or gum tissue. You now align the clip center with the tooth's midline, ensuring even contact across the crown. Once aligned, press gently from top to bottom. Do not snap it on because sudden force can chip enamel. Make incremental adjustments. Small bends at the clip arms will improve bite and comfort. If you need tools, cushion the clip with soft cloth when bending to prevent marks. Make sure to check occlusion. Bite down slowly to confirm it sits flush and doesn't cause discomfort or alter your bite. You finish by verifying comfort and stability over 10 to 15 minutes of normal movement and speech. This reveals pressure points and potential slippage. Once satisfied, clean and store or wear as directed and make sure to soak the clip nightly to prevent buildup. If the clip becomes loose, causes pain, or irritates gums, remove it immediately and avoid DIY forceful reshaping. As a troubleshooting tip, if persistent looseness or soreness appears, stop use and consult a dental professional to prevent damage or infection.
Thanks for watching. Consider subscribing if this video helped you.